नमस्कार साथियों, मैं डॉक्टर लोकेश भाटिया स्वागत करता हूं आज के इस वीडियो में आपका। वर्ल्ड फिजियोथेरेपिस्ट डे, ये तमाम जो डेज रहते हैं ये एक प्रकार का अ डे फॉर एक्सप्रेसिंग ग्रेटिट्यूड टुवर्ड्स देम होते हैं। आपने देखा होगा तमाम जो फिजियोथेरेपिस्ट जो बन रहे हैं उनके प्रति हमें बड़ा शुक्रगुजार होने का दिन है। और फिजियोथेरेपिस्ट का रोल इस पिछले कुछ 20 सालों में बहुत अधिक बढ़ा है साथियों। फॉर एन ऑर्थोपेडिक सर्जन इन हिज प्रैक्टिस, टू स्पेशलिटीज आर वेरी इंपॉर्टेंट. One is radiologist, the one who helps in getting the right kind of x-rays and the right kind of reportings done for their x-rays, MRIs, ultrasound, CT scans. And the another specialty is physiotherapist. Right? Namaskar. Welcome to Lok Talks. Thank you very much for subscribing to this channel for professional medical guidance, spirituality and meditation and life coaching. Here is my WhatsApp number. Do connect me in person if you have any question. Thank you. So, any particular problem when we deal it by a physical therapy or external physical modalities when we use to treat that pain, it's called physiotherapy, right? So physiotherapy, this particular year, another subtitle has been given is Osteoarthritis and its management by physiotherapy. Physiotherapy is one such treatment which practically can give you drugless management. Lot of patients who are allergic to many medications or who are so fragile as far as their gastrointestinal tract, as you all may be knowing or experienced, that many of the non-steroidal anti-inflammatory medications or even the lowest dose of steroids also may give rise to very high acidity levels or the gastric and acid reflux. So if somebody who has very high GI intolerance, gastrointestinal intolerance, we always, for all musculoskeletal problems, we take help of a physiotherapist to address their pain by external physical modalities. Now coming to osteoarthritis. Osteoarthritis, how a layman can make out that this pain is because of osteoarthritis. You must have come across an experience, either your own or of someone else in the family, that whenever they are sitting for some time, all of a sudden when they start walking, they will get a lot of pain in their knees, right? So that is one such manifestation which goes more in favor of osteoarthritis. The joint, that particular joint will be felt to be jammed out. When you continue moving that joint, then you start feeling little better. In layman's language, हिंदी में पेशेंट्स कैसे समझाते हैं इस तकलीफ को कि सब वो जोड़ का जो है पानी सूख गया है ना? So it is something like that. The lubrication of the joint is much reduced a lot, and they are facing problem as and when they start suddenly walking or morning steps when they move out of bed. Mainly the pain in the osteoarthritic patient will be bothering you much more by evening, by late evening hours. Once the day work is finished, then it will be bothering much more. But as such, when it becomes little mild to moderate grade, it will start bothering as and when you sit for some time, you want to walk, and it will be becoming very painful. So body weight, yes, body weight has got a great relevance as far as your knee pain is concerned. The main target should be weight reduction. There again, the physiotherapist can help you by guiding you on their clinical nutrition part, by advising you the right kind of exercises, by doing regular exercises to weight reduction. And the main role of a physiotherapist will come for guiding you to do regular exercises of your thigh muscles, the quadriceps and hamstrings muscles have to be strengthened. जितनी ज़्यादा ताकत आपकी quadriceps thigh group के front group की जो muscles रहती हैं वो quadriceps कहलाती हैं, और जो posterior aspect की जो पीछे वाली जो muscles होती हैं थाई की वो hamstrings कहलाती हैं. इन muscles को हम जितना ज़्यादा strong बनाएंगे, जितना ज़्यादा हम strong उसको बनाएंगे, the more stronger the muscles you have. You must have seen all those football players. Many times the camera is focused so much. Nowadays the FIFA World Cup is going to come here in Qatar. We will get opportunity to see international football players, and you will be able to see their excellent thigh muscles built. Many times the camera is focusing so well. I really enjoy watching their close-ups of their thigh muscles, how well built their muscles are. So the best way to counteract the problem what you are facing because of osteoarthritis is to start developing, to start strengthening your quadriceps muscles, your hamstrings muscles, and that is the only way to address your problems what you are encountering because of osteoarthritis in your knee joint. As such, osteoarthritis, if I tell you on the scientific terms, it is the wearing and tearing of the cartilage. Let me help you with this model. This particular cartilage, with what you are seeing here, okay, this particular cartilage, this thickness gets reduced, and the height, the medial compartment gets too much reduced, and it may develop an angulation too. So the movement of the knee joint becomes very much painful because the nerve endings on both the joints are rubbing against each other, and as and when you start walking, you start getting pain, right? You may get pain more in walking, more in climbing. So that climbing pain is much more common in the patellofemoral joint. This is patella and this is femur. That bone, when it starts rubbing with each other, or there may be chondromalacia patelli. Maybe sometime I'll make a separate video on chondromalacia patelli to explain you much more. But just to remember this. So all these things can be addressed very well by taking help of a good physiotherapist. Physiotherapist will definitely help you to make you understand what kind of exercises you can do it regularly at home, and regularly keeping your body more fit, so that you need not to go to any doctor even, right? So this is what all I wanted to share about the physiotherapist. We must congratulate them. We must have the gratitude towards them, that because of their hard efforts, very comfortably we are able to address our body physical problems, and their dedication, their contribution to their dedicated services should be appreciated. Thank you very much. I congratulate all the physiotherapists around this world. Thank you very much. Take care. Bye-bye.